like that. One Flew Over the Cuckoo's Nest shows Jack Nicholson getting ECT. And in those days, when they did ECT, which is an electrical stimulation that they put through the brain, it causes a seizure, he was awake. I mean, the folks were awake back in those days. Now, it is an effective treatment, and it does treat depression, but they don't do it in folks who are awake now. We do this under anesthesia. So you go in just like you were going to have some kind of outpatient surgery. You get put to sleep. There's a mask that they use for you to breathe, into, and the anesthesiologist breathes for you with the bag thing. And they paralyze the muscles so there's no shaking. You don't shake or any of that stuff. You're basically asleep, and they give the electrical stimulus, and you do it 3 times a week. And after usually about 2 weeks, 6 treatments, it's the most effective treatment for depression that we have, bar none. I mean, better than medicines even. And I've actually saved people's lives with that. And I can tell you a story about that if you want. But go ahead. You had a question?
How does that affect the brain? A friend has had a stroke, but the neurologist says that from the treatments, I can't remember if it's the lighter area or the darker area of gray is because of those shock treatments of the brain.
You've got pieces and parts of things in there that I'm not sure about. Now, there is white matter and gray matter of the brain, right, and that's normal. I mean, all of us have that, the gray matter and the white matter. So ECT doesn't give you more or less of that. Stroke might. I mean, of course, a stroke is where you kill.
He's got 2 neurologists, so one from the shock treatments and one from the stroke is what's caused the bigger difference or whatever.
Okay.
But you don't really...
No, ECT doesn't cause brain cell loss. It doesn't kill nerve cells. As a matter of fact, remember me talking about antidepressants and how they make you grow new nerve cells? ECT does the same thing except more. So ECT, studies have shown that it causes you to grow new nerve cells. And what it is like having a seizure, really. It's exactly like having a seizure disorder. And everybody gets scared about seizures, but really seizures are in and of themselves, the electrical activity that happens in a seizure in the brain is not dangerous. What's dangerous is if you stop breathing and you don't wake up because you choke to death, or you stop breathing during the seizure. So the seizure itself doesn't damage the brain, and for the ECT, it doesn't damage the brain. So I would disagree with the one neurologist. I would say that the other neurologist is more on the money if he says it's not affecting the brain, not affecting, damaging the brain. It's definitely affecting the brain. Did that answer that?
Yeah.
I think I tried to.
I got it out there, right? Yeah.
Okay. Yeah. Another question.
I have a friend that suffered with depression, and nothing was working. And
yes.
She had ECT about 4 years ago. And after the ECT treatment, the depression was better, but her memory.
Okay.
A terrible memory problem.
Okay.
And now, just recently, she was diagnosed with Alzheimer's.
Okay. And you're wondering, so the question is, a person who, how old was the person?
She was 64.
64-year-old lady who had no signs of Alzheimer's disease that you know of, okay, but got depressed, got severely depressed, so much so that medicines didn't work, and then the physician did ECT, treated the depression, but the person never recovered, and their memory kind of slipped, and they ended up having Alzheimer's disease. Let's talk first about memory and ECT, okay? When you have the ECT, there is a short-term, there's definitely a memory loss around the time of the treatments, okay? Part of that's because of the anesthesia, and you have little black spots where the anesthesia was given. But the other part of that is probably related to the treatments and to the depression and everything all wrapped up in one. Those 2 weeks or so may be a kind of a blank for that person. But studies have shown that it does not interfere with long-term memory, and it does not interfere with your ability to learn new things going forward. So my guess is, remember me talking about how Alzheimer's disease, sometimes you'll have depression before you even know you have Alzheimer's disease? Why? I mean, we think the reason is because the nerve cell loss or the damage that's going on in the brain as part of the Alzheimer's process is actually causing the depression. And so then you see the depression, you don't really see the memory stuff yet. All you see is the depression. You treat the depression the best you can, and then you start to see the memory stuff as the time goes on. So like you said, after 4 years or so. So it's not like she I would imagine she didn't have the treatments and then she was had severe Alzheimer's right away,
No.
right? She probably gradually slipped into the Alzheimer's thing later on. But I understand. I mean, a lot of folks would fear that. They would say, "Oh man, that's got to be the ECT treatments." Probably not. We've studied that a lot because there's a lot of fear about memory with ECT. So, matter of fact, I've had patients. One of the greatest cases I can say I had was a gentleman who came to me. He was 81 years old and had just got through battling cancer, and was psychotically depressed. He was actually convinced that he was given cancer by God as a punishment. And of course, no matter how much you try to explain to him, I don't think so. I mean, the God I know wouldn't do that to somebody, you know. So, but reasoning didn't work, and medicines didn't work. I kept trying to give him medicines he wasn't eating. He was probably going to die if I didn't do something quick. So I referred him for ECT. And his daughter came back, and it was several weeks later, his daughter came back and said, "I just want to thank you. You saved my dad's life and brought him back to his normal self." And sure enough, he was able to carry on a conversation. He looked like he had Alzheimer's disease as part of his depression. But when we treated his depression, his memory was fine. And I saw him for 4 years before I left practice, and he was doing fine. He was walking a couple miles a day. He was taking his medicine. He was not depressed, and his memory was fine. So ECT doesn't cause Alzheimer's disease, obviously. I mean, you know how many people have Alzheimer's and how many people have ECT. You know, not too many people get ECT, but there's an awful lot of folks with Alzheimer's. Yeah.
I just wondered, like, if you suffered with depression for years and you've been on medication after medication, at some point in time, what happens to the medications finally wear out?
Oh, that's a great question.
And you have to have ECT? I mean...
That's a great question. And the longer somebody struggles with depression, the harder it is to treat it, the harder it is to get it better. And I don't know why that is. I think when we think of some of these illnesses, that happens with a lot of these things. So like the longer somebody's manic, the harder it is to get them out of it. The longer somebody's psychotic with schizophrenia, the harder it is to get them treated and get out of it. Why? I don't know exactly why. In the brain, I guess I don't know exactly why. I can't give you some physiologic answer for that. I would say that my advice to you is that if you know somebody who's had that happen, where they have severe depression that goes on for years, and they try medicine after medicine, and nothing seems to help. There are a lot of kind of fringe or sort of experimental or research type treatments that we're doing that are not like inhumane type things, but different things that you can try. ECT is one, but there are different things, and you probably at that point would want to see a specialist in a like an IU or even somewhere else like Mayo or something like that. And I'm talking about a specialist for psychiatry. There are a lot of stuff. I mean, they're using magnetic stimulation to try to avoid using electrical stimulation instead of ECT. It's called transcranial magnetic stimulation. So person's awake, put the magnet on their head and send a magnetic pulse in, and that treats the depression. At this point, it doesn't look like it's no more effective than ECT. Probably not as effective as ECT, but someday maybe they'll get there, and that's a lot easier to do. You don't have to do anesthesia and all that stuff. So there are a lot of different types of treatments. The other thing I would make sure about is that the person, number one, took their medicines as the doctor recommended, because a lot of folks will take it and then it doesn't work in a couple of days. I'm not taking this junk, it's not going to work. The other thing is a lot of doctors don't necessarily follow the person close enough and make sure that the dose is right on the medicine. So if you don't have the right dose, you might improve temporarily and then sink right back into depression. And that's probably worse than getting no treatment at all, because the person's getting it's in the brain. That's probably worse. So make sure that those things are that you look into those things. I would say. Anybody want to know about alternative treatments? St. John's wort, omega-3 fatty acids, fish oil, SAMe. Have you heard of those things?